So today I'll be talking about the difference between empathy and sympathy from a counseling perspective. Now these two terms are interesting in that there are a lot of different definitions of empathy and sympathy out there, depending on the field and the area in that field. So I'm going to be giving you my perspective on the difference between empathy and sympathy and why it's important. So I'm going to start with adding another term to the mix, which would be compassion. So I'm looking at really three distinct terms: empathy, and there's a few types of empathy, sympathy, and then compassion, and how these fit in with mental health counseling. So let's take a look at empathy first. Strictly speaking, empathy is intellectually understanding, cognitively understanding the feelings of another person. The term itself alone, empathy, doesn't necessarily mean that there'll be an action that takes place. It's just that understanding intellectually. It's not something extra necessarily. That would be a cognitive empathy. There's also an emotional empathy, and that's where, to a small extent, you can feel what somebody else is feeling. Now what's important there is a small extent, because really here we're looking at the distinction between empathy and sympathy. Emotional empathy is quite similar to sympathy, but in emotional empathy it's feeling what somebody else feels to a small extent. Now the other part of empathy, what sometimes we think of as attached empathy, what happens next with empathy, would be communicating the understanding. So you have an intellectual understanding of how somebody feels. You can feel what they feel a little bit, and you communicate that to them. You express to them in some way, verbally or non-verbally, that you understand at some level what they're going through, what they're feeling. So that would be empathy, and then a counseling skill that includes empathy. And it could be reflection, it could just be a statement, but it's some sort of counseling skill that you're putting together based on having empathy. Now let's move to sympathy. Sympathy has a few different definitions. We can think of sympathy as sharing the feelings of another individual. So if a client's in session with a counselor and the client starts crying, they start having feelings of, say, sadness, and the counselor were to start crying, that would be sympathy. That would be sharing the same feeling. Now of course crying is a behavior, but we oftentimes tie that to a feeling, usually a feeling of sadness, but not always. Now you could also argue that compassion moves in on the definition of sympathy here a little bit, because compassion is to be sharing the same feeling. But clinically I look at compassion as a more intense form of sympathy. So another definition of sympathy is feeling sorry for somebody. Right? And that's not typically how we look at it in counseling. We tend to think of sympathy as sharing the same feeling. But feeling sorry for somebody would also be sympathy, and we could see that in a counseling setting. So compassion, as I mentioned, is sharing the same feeling. And the way I'm using it here in terms of counseling is it's fairly intense. So if somebody has a feeling and their intensity, let's say a 1 to 10 scale, 10 being the highest intensity, was a 6, perhaps the counselor is at like a 4 or a 5 or 6. Like they're experiencing a level of sharing that feeling that's fairly high. They're really experiencing that along with the client. That's a more intense form of sympathy. So sympathy, you feel it a little bit. Now even with empathy you can, but sympathy a little bit more, and compassion even more than that. And arguably with compassion, like using that example of the 1 to 10 scale, the counselor could be experiencing that feeling even more so than the client. I would definitely put that in the compassion category as opposed to sympathy. So why is this important to mental health counseling? Well, we generally think of emotional empathy and cognitive empathy as positive. We think of those as skills that counselors generally use to help clients. That's how we understand it. Sympathy, we understand, happens sometimes. Sometimes there will be a little bit more intense sharing of feelings, not to the point of compassion, but fairly intense, more intense than emotional empathy. And we view this, I do anyways, kind of on the fence, right? So emotional empathy is good to some extent. Sympathy can be good, and of course it will happen from time to time between a counselor and a client, but it's not necessarily healthy if it's done too much, if it's overused. Compassion, I would say compassion happens once in a while too, but I would have even more caution with compassion being overused in sessions than I would sympathy. And the concern, of course, is that if you're as a counselor, if you're experiencing the same thing a client's experiencing day in and day out, that could cause what we refer to as compassion fatigue. It could run the risk of burnout. Whereas empathy, you could have burnout from empathy, from emotional empathy, and even intellectual empathy. But generally we feel like that's a safer skill to use repeatedly than sympathizing or having compassion. Now again, these words I'm using in a clinical sense. So of course counselors are regularly going to have empathy and sympathy and compassion for their clients and all human beings. But I'm using them here in a sense of how to define boundaries. What level is healthy to repeatedly use in sessions from a counselor's point of view, and what level may be unhealthy or less than healthy. And again, I would look at empathy as generally being a good idea, a good skill, sympathy a little more questionable, and compassion, I would have the most skepticism in terms of using it all the time. So that's the distinction that I would draw between empathy, sympathy, and compassion. I hope you found this video to be helpful. Thanks for watching.